and we will go ahead and address them at the end of the presentation. I am Carrie Millar with FDA Services, and along with me today is Scott Roostrom with FDA Services. He's our Chief Operating Officer, and I am the Membership Services Manager. This over to Scott for the beginning of the presentation.
All right, thanks, Carrie. Well, today we're going to be talking about preparing for 2014. Obviously, healthcare reform, especially the contentious aspects of healthcare reform, are fast approaching. And FDA Services is trying our best to be the eyes and ears for our members, and we're staying up to date literally on a daily basis as new regulations and clarifications are coming out by the Department of Health. So we're briefly going to touch on the points below, and we'll discuss what we know as of today. The individual mandate, basically what this is and how it affects U.S. citizens. Employer penalties and fines, we're going to discuss what this means to employers of various sizes, 50 and over and 50 below, as well as the individual marketplace, or what you maybe have heard as the public exchange, who's eligible to purchase on these types of health exchanges. And then we're going to talk about small employer options and new strategies that are emerging. One that Carrie will talk about today is the defined contribution strategy, which is going to play a prevalent role as we move forward after October. Then we're going to talk about what Aetna is doing on the group early renewal options, and this is a way that Aetna is addressing the rate volatility starting in 2014. Let's quickly go through some definitions. This is the new vernacular of healthcare reform, and you'll hear these kind of bantered about. The first is, of course, the Act itself, the Patient Protection and Affordable Care Act, which is the signature legislation of President Obama. Actuarial value, AV, this is basically the share of medical spending that is paid for on behalf of the plan of the insured, and you'll see this expressed as a percentage. As we get later into the presentation, you'll see these as percentages, 60, 70, 80, or 90. That's the amount that the insurance company is paying on your behalf. FPL, which is the federal poverty level. This will be important for individuals that fall within a certain range, and they're going to be the ones that are eligible for subsidized health insurance on these public exchanges. Out-of-pocket maximum, which is basically what the insured is financially responsible. Usually it's the co-pays and deductibles that everybody's commonly used to. Essential health benefits. These are a core package of about 10 categories that must be covered on health insurance purchased in the exchanges and off exchanges. A grandfathered plan are those that were enforced prior to March 23, 2011, and these are exempt to some of the ACA provisions. Then there's the minimal essential coverage. This is the coverage that's needed to avoid the individual mandate penalty. These coverages do not have to include essential benefits to meet that minimum essential coverage arrangement. And then lastly is the HRA, and that's something that we're really excited about, the health reimbursement arrangement. And that's something that Carrie will touch on a little later. And it's the way an employer can offer employee benefits to their employees by designating funds that are available for reimbursement, which includes health insurance premiums. Let's get to the individual mandate. Starting in 2014, every American is going to have to show that they have proof of insurance or pay a tax penalty. In 2014, the penalty is pretty small. It's only $95, but that does jump up quite a bit in 2015 and then even more in 2016. So while the penalty is not real stiff in 2014, it is going to be phased up quite a bit by 2016. But in a nutshell, Americans are going to have to prove that they have health insurance or pay these penalties when they're paying when they're submitting their 1040 tax forms. Employer penalties and fines. Employers with less than 50 full-time employees are not going to be fined by the government for not carrying group health insurance for their employees. But on the other hand, employers with 50 or plus that do not offer coverage to their employees are going to pay a fine of about $2,000 per employee. Now, the first 30 employees are waived. They won't be fined for the first 30, but any employee 31 or above will be fined $2,000 per employee. That's a pretty stiff penalty, so a lot of employers of that size will weigh whether it makes sense to pay the penalty or if it's less expensive to just buy the health insurance. But generally for our employers, our dental office is less than 50. There's not going to be any kind of penalty for not offering group health coverage. The exchanges, or what the federal government is calling these online marketplaces, there's several types. One is the public individual exchange, which is the individual marketplace. In Florida, our legislature has opted to adopt for the federally facilitated exchange. So the federal government will be setting up the individual exchange that Florida citizens will be able to participate. And this is where citizens that fall within a certain range of the federal poverty level will be able to get subsidized help towards their premium and maybe even qualify for some cost sharing expenses as well. Then there's the public group exchange, or what is known as the shop, and those are for groups under 50. Most implementation of this particular program has been delayed till 2015, and Carrie will have more information on that in just a few minutes. And then there's the private exchanges, and these are individual health plans that are going to be available to individuals that don't meet that federal poverty level criteria and will not receive any kind of premium subsidies from the government. So many of our employer members fall into this category, and we will definitely be participating in these private individual exchanges. Some of these private exchanges, maybe only one carrier might participate and offer several plan options. There's going to be some private exchanges that may have several carriers and lots of options available. So right now, we're kind of testing the waters on that at this moment. A lot of changes to the rating rules starting in 2014, and this is going to create quite a bit of price volatility in the market. So let's just go through these. First of all, there's no more pre-existing conditions, so all coverage on the individual market is going to be on a guarantee issue basis. No health questions will be asked. And then premiums are going to be limited to just a few factors. One is the ratio. The rates ratio is it can only be a 3-to-1 ratio. So the highest rated person can only be 3 times that of the lowest age or the lowest rated person in a group or even on the individual market. So right now there's probably 7 or 8 rating tiers. That's going to be shrunk down to only 3. So we expect younger people to probably pay more than what they're used to paying now. And older Americans are going to be paying somewhat less to kind of close that gap. Family composition, the number of people covered under the policy, geography, and then tobacco use are the other ways that they're going to be determining rates. While there is a higher rate for tobacco users, it's not going to be that much higher, so they're not penalizing the tobacco use as much as they had. So the individual marketplace, again in Florida, this means that the federal exchange is what individuals will go to if they need subsidized health care. They've set it up into plan tiers by metals, bronze, silver, gold, and platinum. And this is where I told you earlier, it's based on the equivalent to the actuarial value. So the bronze plan, the lowest benefit plan, pays 60% of the plan benefits on behalf of the insured, where the platinum plan pays up to 90%. But what's important to note is that the benefit designs are not going to be universal across the carriers. So for example, you might have a plan, carrier A has a bronze plan with a $2,700 deductible with coinsurance of 30%, where company B might also offer a bronze plan with a $6,000 benefit and maybe no coinsurance. But actuarial, they are the same equivalent in that 60% bronze level. So As of the webinars that we've taken with all of the insurance companies, they're still keeping this stuff close to the vest. So we have not seen any plans, designs yet. We expect to start those to be released to us very shortly. For an individual carrier to participate on any the public exchange, they have to offer at least the silver and platinum at the very minimum. They don't have to offer all four, but if they're going to participate in the public exchange, they do have to offer the silver and the platinum at the very minimum. At this point, I'm going to turn this over to Carrie, and she's going to take us through the rest of the presentation.
Thank you, Scott. So we're talking about the individual marketplace, and people were trying to get an idea of when it opens up initially and then when it's going to be continuing to open up. So the initial open enrollment for the marketplace is going to start on October 1st of this year. And from what everybody is saying, according to the Department of Health and Human Services, they are on schedule to open up October 1st. The October 1st enrollment will be a January 1 effective date. And then any enrollments that they receive after December 15th would then be a February 1 effective date, and so on and so forth until March 31st is when they take their last application for an April 15th effective date. In the subsequent years following this initial open enrollment, there will be an open enrollment period of October 15th through December 7th, which correlates with the Medicare open enrollment period. So when you turn 64, and are about to turn 65, you would be able to come off the individual marketplace and onto Medicare supplement plan annually. In addition to the open enrollment periods, which is when you would be allowed to switch carriers, switch metal levels, you could go from a silver to a gold plan. There are special enrollment periods that they're going to let you come on if you meet qualifications. So there's been a lot of talk about people saying, oh, if I break my leg, I'll just then buy the insurance. And that's not actually the case. If you break your leg, you can't just get the insurance. You're going to have to wait until an open enrollment period. However, if you have lost your job, if you get a job and no longer qualify for Medicaid, if there is a divorce, if there is a birth, any kind of those type of life-altering situations would be considered a special enrollment period, and they would allow you to change the plan that you are currently on. That are available to the individuals that financially qualify. So if they are between 133% and 400% of the poverty level as an individual or as a family, depending on how they file, they would qualify for some type of premium subsidy on the exchange. They will find out based on their 2013 federal income tax return, what they would qualify for, and if they're enrolling in October through January, they would base that on their 2012 income tax returns. The government would then send the subsidy to the insurance carrier, and the remainder of the premium would then be what the individual had to pay for. So moving on from the individual marketplace, which is where individuals can purchase insurance through the federal exchange in Florida or in other states through the state setup run exchange, is the public group exchange. This is for group health insurance for employers of less than 50 in what they are calling the shop. Initially, this was supposed to be set up where an employer could come in with less than 50 employees, and they could give a defined amount of money that met certain thresholds, so it couldn't be too low, but you could go in and say, I'm going to give each of my employees $500 as a benefit. You had to meet participation guidelines, and then your employees could pick whichever plan on the shop, with whichever carrier that they wanted to be insured by. However, we just found out in April that the different plan choices on the shop, not the shop itself, but the actual option for alternate different every employee to be in a different plan is being delayed until 2015. So the only benefit currently on the shop, because all of the employees would have to be on the exact same plan, is that if you were to qualify for any small business health insurance tax credit, your plans would have to be purchased through the exchange, and you would only receive those premium tax credits for the first 2 years that you were on the shop. From what we are hearing from all of our current group health insurance carriers like Aetna and Florida Blue and United Healthcare and AvMed and Humana, is that they may have one or two plan options on the shop, but that they don't expect it to really take off until at least 2015 or later, and that they are going to be offering a much larger amount of options on the private market and not the public group exchange for the shop. And the shop also has no subsidies for premiums. So employees that are at your office that go on, if you were to purchase a shop plan, which everybody would be on the exact same plan this year, any premium that an employee would be responsible for above what you pay for would not be subsidized. So even though it is a federal exchange for the small group, it is not the individual marketplace, and there are no subsidies available. In addition to the public options, there are going to be several different types of private exchanges. Scott talked a little bit earlier about the private individual exchanges. There will also be private employer exchanges. However, from what we are seeing right now, the biggest ones are going to be for employers at 100 plus. So Merck has an exchange, Aon has set up a private health exchange, but those currently right now are just for employer groups of over 100, which is not something that is going to directly affect a lot of our small dental offices. However, we do see that the individual private exchanges for individual health insurance will be an avenue, as well as some of them may start offering small group exchange options. So what, as an employer, can you do? As a small employer of between 1 and 50, you're going to have two options come October for starting in January 2014 options. Obviously, if you renew later on in the year, you are not faced with these options to make these choices right away. You can delay these until your renewal. So you are going to either be able to maintain a group plan, or you're going to disband your group plan. If you choose to maintain your group plan, you can continue to purchase it through a private market plan, such as Aetna or Florida Blue or United Healthcare or Humana or AvMed or any of the other Florida admitted carriers. The other option would be for you to purchase it in the shop or the government small business exchange. We do not have the plan benefits or even a list of carriers that are going to be participating in the shop. And as of right now, they do not expect enrollment to start in October. They actually expect enrollment to start in January for the shop plans for the small group employers. So the other option is going to be to disband your group plan, which could be for many different reasons. You could find that you need to disband your group because you're no longer going to meet participation guidelines. It is no longer financially affordable for you to pay for the health insurance plan that requires the essential benefits. Or you have just really done some soul searching and decided that it's going to be, a better option for your office to just completely get rid of a health insurance benefit altogether, as well as it might make financial sense for you to disband the group and then pay for a portion of your employee's individual plan. So when you decide to disband the group, your employees will then, and yourself, would have a choice to either purchase an individual plan on the individual marketplace, which is the federally run exchange in Florida, and any employees that qualify for subsidies would qualify for those subsidies, and you could then help pay for the balance through a different type of arrangement, as well as you can also just purchase individual health insurance on a private exchange or through a private carrier. And we were talking a little bit about how you can help fund your employees' individual insurance premiums, whether it is on the private exchange or individual marketplace or so the private exchange or the public marketplace that they're purchasing the insurance. So as a small employer, you can set up an HRA, which is a health reimbursement arrangement, to help fund employees' insurance premiums. This arrangement is not pre-funded, and the amount that is given is defined by the employer. It is not a health insurance plan. It does not qualify as a health insurance plan, and nor does it exempt any employers over 50 from having health insurance in place. This really is for small employers that are less than 50 that do not have to worry about the penalty for not carrying insurance. And how this plan works is that you as the employer set up a defined amount of premium that you're going to pay for your employees. It can be a certain percentage of what their individual premium could be, up to a certain dollar amount, or it could be a defined dollar amount. So you then say to your employee, instead of me offering you a small group plan where I pay 50% and you pay 50%, I will pay 70% of your individual health insurance premium up to $350 monthly. The employee then goes out and purchases an individual insurance plan, whether it's on the individual marketplace or from a private carrier. They then submit and claim to the health reimbursement arrangement company. They can fill out a continuous claim form. So if they have an annual policy and they pay monthly, they can just send in the bill and have it be a continuous form, so they're not sending it in every month. The health reimbursement arrangement company, the HRA claims processor, makes sure that it is a qualifying expense. You can choose to only fund individual premiums. You can choose for them to use those funds for other medical expenses such as copays, coinsurance, or deductibles if they are insured through their employer. They can use it for prescription benefits. They can use it for other medical expenses that are qualified under the IRS guidelines. And once the claim processor agrees that it is a qualifying expense, they then send the report to you as the employer. They can do it in a QuickBooks format. They can do it in an Excel format. So you can just give it to your payroll accountant. And you then add that reimbursement to the employee's payroll as non-taxable income. So let's look at an example of how an HRA works. Dr. Roostrom, will use Scott as the example, has 6 employees and 4 of them are full-time. He sets up an HRA to reimburse all full-time employees 75% of their individual health insurance premium up to $350 monthly. The maximum Dr. Roostrom is liable for monthly is $1,400, which is the $350 times the 4 employees. But his actual cost could be less because that is a liability. He is not pre-funding these accounts, and if the employees are not fully using the accounts, then that is not money that he is paying for. So we'll look at an example of employee 1. Employee 1 can get 75% of their premiums up to $350 monthly. They purchase a plan for $350. Dr. Roostrom is going to pay 75%, which is $263, and the employee would be responsible for $88. Employee 2 went out and bought a very nice plan for $600. 75% of that is higher than the $350, so the maximum Dr. Roostrom would pay would be the $350, leaving the remaining balance of $250 for the employee to pay. Employee number 3 is not going to purchase an individual health insurance plan and has decided to go on her husband's group plan. In this situation, because only premium is what he's offering to cover, she would not be eligible for any portion of the $350 because he is not funding an individual insurance plan. And because she's on a group health insurance plan, which is paid for with pre-tax dollars, it is not possible for her to submit the group plan as a valid claim. So using these examples, his actual cost is $963 a month, and this amount is reimbursed back to the employees as pre-tax or non-taxable income. So the employee saves money by not having to pay taxes on that income, and it is also considered a business expense under a Section 105 for the business. So instead of saying to your employees, I'm going to give you each $200 and you go help with your health insurance costs, you have to pay, they have to pay taxes on that income, and in this situation they would not, as well as that is not a business expense for you to use as a deduction on your taxes. Additionally, the employee portion, so what the employee has to pay, can also be set up to be paid pre-tax using pre-tax dollars through Section 125, which most of us are familiar with right now if they have a cafeteria plan already set up for their office. And this is true as well. The unfunded portion of the individual premium can be paid with pre-tax dollars by the employees. So you can actually look in the June issue of today's FDA. I have written a much longer article on the defined contribution HRA arrangements and if they're right for your group and if they are right for your group, when they would be right for your group. This is not something that we are encouraging small groups at this point to do, but it is going to be an option come 2014. The reason why we are not encouraging small groups to disband their small group and jump to these arrangements right now is that there is no guaranteed issue plans for individuals at this point. And there are a lot of offices that have employees that need maternity, that have employees with pre-existing conditions, and if they are not able to go out there and purchase individual insurance currently, then that is not, you can find yourself in a sticky situation where the employee benefit that you're giving is going to be perceived as a penalty in the employee's mind and is not really going to be encouraging them to purchase any type of insurance if they're not able to get it. So, however, starting in January of 2014, with enrollment starting in October, all individuals will be able to qualify for guaranteed issue health insurance, and depending on their income, they could possibly even qualify for a subsidy. So the final topic we're going to talk about today is Aetna and Aetna's group renewal option. For all existing and new business Aetna plans, and we're not saying if you have a Blue Cross Blue Shield plan or United Healthcare plan or an AvMed or Humana, you need to cancel your policy and switch to Aetna. What we're saying is that if you're with Aetna or you are considering a move, Aetna will be allowing an off-anniversary renewal on 12/1/2013 for all plans to avoid any rate adjustments under the Affordable Care Act until the last possible month of implementation in 12/1/2014. What this will allow them to do is essentially lock in rates going forward for a longer period. So if you have a high deductible plan that no longer meets the essential benefits and is not a grandfather plan, you will be forced to migrate to a lower deductible plan to meet those 10 essential health benefits. Additionally, if you have a health insurance plan where a lot of younger females or males are insured, you can be hit by community ratings much harder than an office of older males and females because of the new community rating structure. Additionally, there are quite a few taxes that we talked about in our previous webinar in January and that there are articles on in today's FDA that are going to start coming to effect in 2014 that will result in a 3 to 6% increase in your premium at renewal because of the different taxes and fees with the ACA implementation. So this will allow you to avoid those taxes and fees for an additional 11 months. We have not found any other carriers that are currently allowing everybody that has a health insurance plan to renew early. There are some situations with United Healthcare and with Humana where January and February renewals will be allowed to renew early in December. And as of right now, Florida Blue, formerly Blue Cross Blue Shield of Florida, is not going to allow any of their group plans to renew early. So, but we are working with the carriers to see if this is going to hopefully be an option for at least those January and February renewals until we have an idea of the impacts of the ACA on the small group market. So what's coming? What have we not addressed and what have we not found out yet and what are we waiting for? Well, we are going to do another healthcare reform presentation in September, and we will be able to then cover the actual individual marketplace plan options. Currently we know that they're going to be the metal, what they're calling the metal plans, the platinum, gold, silver, and bronze options, but we don't know what those look like. We have not gotten indications from any of the carriers on what the prices are going to be for each individual demographic and different area of the state as far as what the pricing is going to be. Everybody is really keeping that very close to the vest because they know that every other carrier is also waiting to see who's going to do what plan and what their prices are going to be. From what we are hearing from a lot of the carriers is that if on the individual marketplace, the plans are going to be substantially higher premium than what you would see on a small group plan if you do not qualify for any subsidy. The reason for this is that the carriers are going to try and discourage small groups from disbanding and going onto the exchange through the federal exchange. They would much rather have them go through the private exchange or directly through the private market on an individual or group basis because they're not as regulated as what they have to do on the public health exchange platform. We are also going to know exactly what the private exchange options are going to be. And we'll go over the enrollment process and the application for the private option as well as the public option. We feel that that's going to be completely online, that there will be a very automated system. We know that that's definitely going to be the fact for the private exchange, that you will be able to look at your different options. You will be able to essentially put them in your cart and check out and fill out the form and pay for the insurance and go ahead and get it in place because there is no medical underwriting that takes place. We are hoping that the public exchange or the individual marketplace is very similar. However, what we have seen so far is that it's going to at least be a 4-page application that came out last week. It will require a lot more financial proof as far as your income taxes if you're going to qualify for any of the subsidies. So we will have a better idea of what that's going to look like. We will also have a much better idea once we have the costs for the private and public individual plans for what it's going to make sense from a small business strategy. If it's going to make sense for you as a group to disband your plan, to keep your plan, to purchase your plan through the shop. Once we have an idea of what that rating structure is, we'll have a better idea of what we can recommend to you. Obviously, we're going to recommend to our current existing FDA clients at their renewal on an individual basis. If you're currently with Aetna, you are already at your you get your 75-day renewal letter, getting all the information on what it would be to do an off-anniversary renewal as well. We will be contacting most groups that are January, February renewals as early as September, October to look at what their options are going to be coming in 2014. So we're really going to make sure that our existing clients are very prepared for this. And we are happy to do this for all FDA members. And if you are not an existing client of ours, we are happy to help you with this process if you would like to become a member or a client of ours. So That is all I have for this presentation. So we're actually over our 30-minute marker. So if you have any questions, we're going to encourage you to put them in the left-hand